Mr. Chairman, you are now live on YouTube, and we will go ahead and start controlling entrance to the room.
Okay, welcome everybody. We're back live on JAC. Representative Schwartz just joined us as well. So Don, go ahead.
Thank you, Mr. Chairman. For the balance of the meeting, the presentations will be made by Councillor Ted Hewitt and Councillor Anna Mumford. I believe the first bill for your consideration is 21 LSO 0346. This is the Interstate Compact for Educational Withdrawal. This was a governor's request to remove Wyoming from the Education Commission of the States. And I believe that Rennie McKay or Lachelle Brandt from the governor's office may wish to describe the purposes of the bill.
But before we do that, Don, just now, is this the updated Zoom version? And so just remind us of the mechanisms for bringing in public comment and how that works. And I think it restricts our ability to kind of go in and out from this setting. Is that correct?
Mr. Chairman, Karen Von, I'll explain that to you and how that works. We will not have breakout meetings specifically through the Zoom platform. I'm happy to put up the meeting slide saying that the committee is on break, at which point you'll have to go into another platform, whether it be a Zoom platform, Teams platform, etc., in order to have private meetings. As far as attendees, you should see under your participants, you'll have panelists and attendees. Panelists have access to audio and video. Attendees are currently in listen-only mode and do not have video. If you wish any of them to be promoted to panelists, you're welcome to do so, or you can direct staff and we will control entry and egress from the room.
Okay, at this point, I'll just have you take care of that, just so I don't have to. I think that'll be easier, but all right. Any other questions about that process? All right, then Ted, are you up? Is that right? Or I see Anna.
Thank you, Mr. Chairman. I'll take the committee through this bill draft really quickly. It's a short bill, but then as Don mentioned, I believe there is members from the governor's office in the waiting room. So this is 21 LSO 346, working draft .3, and it was requested by the governor's office, and it's step 3, COVID-19 budget reductions. Section 1 of this bill draft on page 1 would withdraw Wyoming from the Interstate Compact for Education by repealing the compact in statute. If you turn to page 2, section 2, this would require the Secretary of State to transmit a copy of this act to the Education Commission of the States, and section 3 makes the act effective immediately, Mr. Chairman.
Anna, what's the fiscal impact? Just remind me.
Mr. Chairman, I will give you the number that was provided in the supplemental budget. I believe that was $53,100 per year with $106,200 per biennium, and maybe Don can confirm.
He did. He gave us a thumbs up. Okay. Do we have a motion on the bill? Moved by Representative Kenner, seconded by Senator Guru. Discussion on the bill. Representative Schwartz.
Thank you. I'm just curious, Ms. Mumford, do we know how many states are in this compact?
Mr. Chairman, Representative Schwartz, I do not, but as I mentioned, I think there is a member from the governor's office who would know more about the compact.
Okay, could we have someone from the governor's office, if they can answer that question, and also just give us any other information from the governor's office? Could we invite them in?
Mr. Chairman, I am working on that now. It might be just a moment.
I think Kevin just popped up. No? Okay. There he is.
Mr. Chairman, I'm here, but I have nothing to add on this bill.
Mr. Chairman, while we're waiting, I do know that Rennie has some comments on this bill. He's been in communication multiple times over the last day or two.
Okay, can someone let Rennie in? And I would just add that if for some reason there's some significant opposition to this from anybody, including the governor's office, whoever this bill is assigned to, the question is, do we make it a joint JAC bill or if it comes back in some other fashion? So I think that we'll have ample opportunity to correct any issues if we go a bridge too far or whatever those concepts are. And also, while we're doing that, Karen, do we know if are there any public comments on this that may be able to help answer some of these questions besides Rennie?
No, sir. At this time, I do not show anyone has public comment for this. However, I would suggest, because of the number of public comment and trying to keep everyone to their topic, that when public comment is open and you're prepared to take that on the various bills going forward, if you would ask those that are attendees to raise their hand, that will give me a cheat sheet of knowing exactly who to bring in the room and who to leave as attendees until they feel prompted.
Okay, did everyone hear that? So as we go through these bills, and if you want to have public comment, when we open it to public comment, you need to raise your hand so that we can let you in. And I think, Kevin, is someone trying to hunt down Rennie?
Yes, I think they're trying to get in right now.
Mr. Chairman, I have resent them a link, so it might just take them a moment or two.
Thank you. So while we're waiting for Rennie, are there any other questions on the bill in addition to this one from the committee?
Mr. Chairman, I mean, my follow-up was going to be, if we're the only, have we had any benefit by being a member of this compact?
Yeah, and follow-up maybe what's the purpose of it and what function does it perform and what benefits do we receive by it? So.
Yeah, and if we're the only state that's not going to be in it, is that the first step towards seceding from the union? These are the kind of things I want to know.
Mr. Chairman, while we're waiting, I'll indicate that the background on this, ECS is based in Denver. They do provide services to both the legislative and executive branch. For example, they testified before the community college financing interim committee this year. They have testified in the past both on recalibration and the general activities of the JEC, Joint Education Committee. We actually provide them with a fair bit of data, and Mr. Wilmarth has presented at their national conference at their expense, not ours, on one or more occasions as well. Most of their data that the state of Wyoming uses from the legislative side is publicly available. So from the legislative standpoint, it does not impair our ability to respond to your requests. Senator Wasserberger is the current designee from the legislature who sits on ECS, along with Superintendent Balo, the governor or his designee, and I believe 3 members of the public as appointed by the governor. That's about the limits of my knowledge of the organization.
Mr. Chairman, and
Go ahead.
Don, how long have we been part of this compact? Do you know?
Mr. Chairman, I'll defer that to Anna. Maybe she knows when that was first incorporated.
Mr. Chairman, I can look that up for you pretty quickly on when at least the state adopted the compact in statute.
So committee, my suggestion is that we vote on this, kick it out, we'll make it a House bill, and we'll find out the answers to that because we're posing the questions. And if we don't think it's, if we concur with the governors, and then we'll further defer to the Senate. If we don't want to do it, we'll pass it back over to you, just in order to get this $100,000 issue off the table for the day. Mr. Co-Chair.
I think that's a good idea. I mean, just a little bit of internet research. Everybody, Hawaii, Oregon, South Dakota, and Washington are not members. All other states, including the District of Columbia, are members. So we would become the fifth state to drop. But I have no problem with moving forward on that. It's easy enough for this bill to to be voted down or not pass if something comes up that we think is that we should remain in the compact for some reason.
Call for the question.
Question being called. Roll call.
Mr. Chairman,
Go ahead.
The vote is on 21 LSO 0346, working draft 0.3. Representative Kinner.
Aye.
Representative Larson.
Aye.
Representative Schwartz.
Aye.
Representative Simpson.
Aye.
Representative Smith.
Aye.
Representative Walters.
Aye.
Senator Garou.
Aye.
Senator Hicks.
Aye.
Senator Kinski.
Aye.
Senator Steinmetz.
Aye.
Co-Chairman Perkins.
Aye.
Chairman Nicholas.
No. Just to be different.
Mr. Chairman, 11 ayes, 1 no, and I believe from your prior comments, this should be a House bill.
That's fine. Okay. Next,
Mr. Chairman, the next draft for your consideration is 21 LSO 350, the Financial Counsel and Reporting Budget Reductions. This bill was initiated by SAO's, the State Auditor's Office, testimony during the budget hearings in December. It does 2 items. It removes a preliminary report and repeals the Financial Advisory Council. It is not part of any budget recommendation per se.
so for committee, I think that this was, what she said is no one pays attention to this report. It's kind of a superfluous work that she's doing. So with, do we have a call for the question? Senator Kinski, seconded by Senator Steinmetz. Roll call.
Mr. Chairman, the motion is on 21 LSO 0350, working draft 0.3. Representative Kinner.
Aye. Mr. Chairman, before we go to the vote, do you want to have public comment just procedurally?
Any public comment? Christie.
Mr. Chairman, thanks. I feel like I missed any discussion that might have happened in the 30 seconds between when I was in the waiting room, or was there none perhaps?
There wasn't. We just repeated what you told us in committee.
Perfect. Mr. Chairman, I'll be really quick. I won't repeat anything you said. Obviously, you know, we like the bill. We brought it up. I would, with your leave, propose one or ask for or beg or suggest one very minor change. And that is on page 2, line 7. And the only reason I bring this up, Mr. Chairman, is if we are getting into this statute, I wanted to float this before the committee. There is a due date of our final report, or the CAFR, Comprehensive Annual Financial Report, of December 15th. We would very humbly ask that the committee consider moving that to December 31st. And Mr. Chairman, here's what typically happens. That, in theory, is, I believe, supposed to refer to the final audited CAFR that is dated by our external auditors. What typically happens is the report is not dated by then, and we submit a final draft to check the box of meeting the statute. But when we submit that report to the governor, Mr. Co-Chair and Mr. Chairman, and then the president and speaker, we have to tell them not to distribute it. I looked back over the last 15 years of CAFR report dates, and 2 of them met that December 15th deadline. The majority are between 12/15 and 12/31. That date is arbitrary. We've tried to dig into where it came from. I speculate that date was born to get the CAFR to legislature before they met with some time to review it. But that becomes somewhat irrelevant, because currently what happens is we submit it to you and say, well, you can't really circulate it until it's stated by the auditors anyway. And I mean, of course, all of you, I think, rely more on other markers and the Craig and whatnot to proceed in the way that you do. Mr. Chairman, I also have checked dates of other state CAFRs in case you might be wondering, well, gosh, are you just trying, are we slipping or whatever? Even our dates between December 15th and December 31st, as they usually are, fall typically below the timeline of all other states, below the average timeline, I should say. So, Mr. Chairman, that's all. I'll stop right there. I'm happy to answer questions, but I know you're behind and have a very robust agenda.
So I do have one question, and that is, Dawn, do you or does Kevin, do you need this report earlier? Do you digest it? Does it make any difference on these dates?
Mr. Chairman, from my perspective, I can collaborate with SAO for information on an as-needed basis, so I don't think it does.
Mr. Chairman, I would concur with the initial draft that the September 30th report is not useful, regardless of the date, and the December 15th report, moving it 2 weeks, has no impact on our work.
Mr. Co-Chair.
Just a question on a comment from the state auditor. She said that it fell below the I think the deadline or the marker. I'm assuming that means earlier than others. As you say below, it means earlier.
Mr. Chairman, yes, Mr. Chairman, Mr. Co-Chair, it is infinitely above all the other states' CAFRs, let me assure you. But for example, fiscal year 19 was an anomaly because of issues you all know about. The average CAFR was dated 207 days after year end, or sorry, 192 days after year end. Ours was 207, and that was last year where we had that very unusual substantial delay. The prior year, the average date was 193 days after year end. Ours was 167. You know, the year before.
Christy, I'm gonna cut you off because I think we're all in the right direction.
Great.
So, is there a motion to amend? Representative Walters.
Thank you, Mr. Chairman. I'd like to make an amendment on page 2, line 7.
Anna, go ahead.
Just striking December 15th and inserting the 31st.
I'm sorry if I didn't track that, but I didn't get a motion to move the bill.
I think we did move the bill, did we not?
We did.
Yeah.
Yeah. Second question.
And moved by Representative Walters, seconded by Senator Kinski to amend, to change the date to December 31st. Any further discussion? Seeing none, all those in favor, raise their hand. That motion passes unanimously. Back on the bill.
Question.
Any other comment on the bill? Seeing none, roll call.
Chairman, the vote now is on 21 LSO 350 Working Draft 0.3 as amended. Representative Kinner.
Aye.
Representative Larson.
Aye.
Representative Schwartz.
Aye.
Representative Simpson.
Aye.
Representative Stiff.
Aye.
Representative Walters.
Aye.
Senator Guru.
Aye.
Senator Hicks.
Aye.
Senator Kinsky.
Aye.
Senator Steinmetz.
Aye.
Co-Chairman Perkins.
Aye.
Chairman Nicholas.
Aye.
Mr. Chairman, would you like a House bill or Senate file?
Senate file. Okay, next bill.
Mr. Chairman, the next bill for your consideration is 21 LSO 362, Working Draft 0.3. This is the WICHE repayment program, veterinary medicine students. This was initiated by JAC. It is would include veterinary medical students under the WICHE repayment program. I believe they're the only professional industry sector that is currently not involved in the repayment program.
Okay, do we have a motion on the bill?
Move the bill, Mr. Chairman.
Moved by Representative Walters, seconded by Senator Guru. Discussion. So members, this bill passed the House in prior sessions. It died because of the strong advocacy of my next door neighbor, Fred Emmerich, my understanding on the Senate side. But we just thought it was appropriate to balance this compared to other professionals that we help fund. Is there, I think we can do a quick walkthrough of the bill. It shouldn't take more than a minute or two. So who's going to present?
Chairman, I'm happy to.
Okay, go ahead.
As Don mentioned, this bill draft would include veterinary medicine students under the Western Interstate Commission for Higher Education Repayment Program. And you can see those additions on page 2. And this would be for the 2021 through 2022 academic year and each year thereafter. On page 3, section 2, that repeals a provision that did not allow veterinary medicine to apply to the repayment program. Section 3 provides that this act will not affect any existing agreements under the program, and section 4 would make the act effective immediately.
Okay. Discussion on the bill. Mr. Co-Chair.
What's the fiscal impact of adding veterinarians?
So you might follow up with that. Was the number of scholarships that we give out for this program?
Mr. Chairman, this has not yet gone through the fiscal note process. It will if you approve it. I suspect it will be number 1, indeterminable, and number 2, outside of the fiscal period, because these are repayments for Wyoming students who participate in WICHE education programs and then elect not to return to the state. They return to another state for their practice. So no one in the current pipeline would be affected. What the fiscal note likely will include is the total number of veterinary students under the WICHE program on an annual basis.
Mr. Co-Chair.
Thank you. Just follow up. Don, do we know what the, is there an annual or an average repayment limit? I can't remember. It seems to me there's some kind of limit on the repayment. We set that. What is the repayment amount? Do we know that?
Mr. Chairman, I believe we have a representative from the university who is entering and prepared to respond to those questions. Mr. Mai.
Morning, Mr. Chairman.
Welcome, Bill. Go ahead.
So, Mr. Chairman, right now, with the budget cuts in place, we anticipate there would be 6 slots for vet students going forward for each year, 4 years of vet school. And right now, the subsidy from WICHE is about half of the annual tuition. So it's about $35,000 per year per student. So if you project that out, you know, and there's a growth rate in that tuition rate, of course, but just as a ballparker, call it $140,000 per student who would elect not to stay in the state upon graduation. is what they would owe the account ultimately.
Thank you.
That helps. And Bill, could you, if this bill passes, gets out here, would you please provide some hard data so that we can have that in front of us and with more specifics?
Mr. Chairman, I will be happy to provide you hard data. Anyway, I'll send it on to Dawn, and I'm sure that Dawn will distribute it to the committee.
And also, if you could provide us, if you have any background knowledge of the number of vets who graduate, who do not, percentage-wise over the years, who, you know, as far as you can go back, who stay in Wyoming and those who do not?
Mr. Chairman, I'll do my best to track that down for you. That may be a little difficult. I'm not sure we require that reporting, but I'll see what I can find.
Well, and if this doesn't pass, perhaps that's something you ought to monitor so that we would have data and you would have data. So any other questions for Bill? Mr. Co-Chair.
Is this to a specific school or schools that we would have a contract with them like we do with our, like, physicians or dentists?
We do, Mr. Chairman. There are 4 participating schools in the Witchy Vet program. CSU is the biggest one. I mean, that's where most of the students end up going. Oregon State has a program that participates. Washington State has a program that participates. And there's actually one in Glendale, Arizona, it's a branch of Midwestern University that has a program.
So those schools might have the data on where those guys go to work. Senator Kinski.
Mr. Chairman, I heard you say that this had passed the House several times and died in the Senate. Other than that, as a rationale, tell me, you know, I know Witchy started out to address a shortage of doctors, nurses, that sort of thing. Is this just an entitlement that we're adding the veterinary medicine? Is this some critical economic shortage that has to be addressed? It's really hard for me to be starting a new benefit in the middle of the financial situation we've got, but I'm open to persuasion if you can give me some compelling rationale, Mr. Chairman.
So Senator Kinski, we're taking away a benefit and saying that you've got to pay this back if you don't stay in Wyoming for that very reason. So it's just the opposite. Representative Larson.
Thank you, Mr. Chairman. And so the Witchy program, at one time, if you were a doctor, a PA, a physician, you know, a number of these professionals that where we didn't offer graduate programs at University of Wyoming would pay for part of the tuition when they went to another school. And then when they graduated, and were not required to pay that back. And I want to say that it was in the mid 2000s that they, and Bill can probably correct me on give us the right time, but they changed that, and they says if you come back to Wyoming, you won't have to, in practice, you won't have to repay that back. But if you stay out of state in practice, you're going to have to repay that fund back. And that included all professions except veterinary medicine. And so this is going to bring that into compliance with everybody else.
Mr. Chairman.
Go ahead.
Yeah, we don't need to belabor it. I hadn't understood that we were already extending Witchy loans to people and they didn't have to pay them back if they went out of state. That answers my question. Thank you.
Okay, further questions for Bill? Further questions on the bill? Seeing none, roll call, please. Oh, wait, is there any other public comment? Karen, do we have anyone in the attendance?
Mr. Chairman, I don't see anyone in the attendees that's raised their hand in order to provide public comment on this topic.
Okay, seeing none. Question on the bill.
Mr. Chairman, the motion is on 21 LSO 362 working draft 0.3. Representative Kinner.
Aye.
Representative Larson.
Aye.
Representative Schwartz.
Aye.
Representative Simpson.
Aye.
Representative Stiff.
Aye.
Representative Walters.
Aye.
Senator Giroux.
Aye.
Senator Hicks.
Aye.
Senator Kinski.
Aye.
Senator Steinmetz.
Aye.
Co-Chairman Perkins,
Aye.
Chairman Nicholas.
Aye.
Mr. Chairman, 12 ayes. House bill or Senate file?
So, Mr. Co-Chair, I would suggest this be a Senate file because we know it's going to pass the House.
Yeah.
Questions of what happens on
Yes,
your
sir.
side?
That's fine. We'll take that one.
Okay. All right, we've got a few more minutes under our calendar. Let's try one more. It's pretty simple.
Mr. Chairman, the next bill for your considerations, 21 LSO 393, Working Draft 0.5. This is the Provider Recruitment Grant Program Repeal. This program provides a funding for malpractice insurance, bonus, transition or moving expenses for medical professionals. The legislation would make the program subject to available appropriation and applies to physicians, dentists, nurses, PAs. This was requested as part of the Department of Health's initiated budget reductions. It's a step 3 budget reduction amounting to $244,000. And Karen, if you would let Mr. McVicker from the Department of Health, he may have some additional comments at the appropriate time.
And Don, that 244, was that a biennial number?
Mr. Chairman, that's correct.
Okay, do we have a motion on the bill, first of all?
Move the bill.
Moved by Representative Larson, seconded by the co-chairman. Okay, discussion on the bill. Eric, go ahead and just give us a quick synopsis of.
Yeah, this was our step 3 reduction. We were proposing for, Don had the right numbers, Mr. Chairman, $244,000 for the biennium. This would eliminate this program. And also, there is a statute. It's 35.1.1101 that we're asking to change the language to say as available appropriations. So as a department, we can unfund the program, but it still exists. So we'd like to have that language in there so that we would be based on the appropriation that you guys give us.
Eric, my first question is, you say it saves 244,000. It'd be interesting to know what that figure is over time for the last 10 years. And it would also then be interested to know where those funds went to. In other words, where those doctors practiced it or who offered it.
Mr. Chairman, I'm sure we can provide that information to you.
I just think it would be nice to know. So is 244 a high number, a low number, a mean over the last 10 years? Or
Mr. Chairman, I don't know that right off, but we can get you that information.
Any other discussions for our questions? Mr. Co-Chair.
Thank you, Mr. Chairman. So if I looking at the bill, if we repeal 35.1.1101, doesn't that get rid of the program completely? I mean, which I think is just different than what Mr. McVicker just told us. So it seemed to me it was a little incongruent. So thank you.
Anna?
Thank you, Mr. Chairman. Yeah, that's correct. This bill draft is repealing the program. So if you do not want to do that, I would ask for a conceptual amendment, and then I would just amend 35.1.1101 so that it's subject to the availability of funds. Yeah. And I would probably suggest removing section 3, which is actually repealing the account as well.
Further discussion. So, Mr. Co-Chair, I would ask for just the body. Do we want to have either the House or Senate consider this and consider taking these actions? Or do we actually want to work the bill? I mean, whoever gets the bill can take these actions and pick which course of conduct. So what's your preference?
Go ahead, Drew.
Mr. Co-Chair, I think that's fine. We don't necessarily have to work the bill. I just, I understand that now. And so I think we can just move, if we want to move and pass on this bill, I think that's appropriate. We'll have more time and to consider it and take public testimony. on it that may be more specific and help us move as we move it along. So thank you.
Yeah, that's my inclination. And Mr. Co-Chair, do you have a preference? This is the House or Senate bill?
No, I don't have a preference.
So is there any public comment or panelists that would like to just kind of give us a quick information before it looks like we're going to pass this in a form but it's going to be worked by whatever committee it lands in, House or Senate side. So most public comment and all issues about this will be addressed kind of at a later date. But I see Shauna Pena. I want to give you the opportunity to chime in since you're here.
Good afternoon, Chairman Nicholas and members. I'm Shauna Pena. I'm with the Public Health Division, and this program lives in my unit, and I'm just here to answer questions if you guys have any questions. Eric McVicker just said that I think you guys had a question on how many providers, how many physicians do we have in the program? Currently, right now, we don't have any in the program, but we have had 20 successful recruits with this program.
Is there a limit you can use per physician or per recruit?
How we usually do it is we offer about 30. This is for the hospitals, and the hospitals, we put out an application, and the hospitals apply for this application for about $30,000 for a recruit. They can use 10% of that for advertising. They can use up to $10,000 for moving expenses for a bonus to get these doctors. This program is also where we focus on trying to get doctors into our places where there's access issues. So our rural health areas that might need some extra assistance to get a physician into that area. So I believe that answered your question.
And so if we pass the bill that makes it subject to funds available, and if recruits are made, or then you would have discussions with the rural hospitals and just see if you can come up with the money if you think it's a good idea for that particular program. Is that a fair statement?
Co-Chairman Nicholas, yes, that is a fair statement. That if the funds were available, that if the legislation was left in and it was for funds available, then maybe when the state is in a better area and more financially stable, then we could work on building in those doctors again.
Rep. Sam Schwartz.
Thank you, Mr. Chair. Ms. Penny, I'm just curious, 20 recruits over how many years?
Let me check my notes. I'm sorry, Representative Schwartz, Co-Chairman Nicholas, let me see my, it was started in 2015.
Excuse me, 2015?
Correct.
Thank you.
So could you provide us with the information of where those doctors were and how much was provided to each hospital that was recruiting? I think that'll just be useful. So, okay, Mr. Co-Chair, if there isn't any other further discussion, I think that my preference is just to approve the bill as drafted and assign it, and we'll let either the House or the Senate take up whether we repeal it or whether we amend it. Is that good with you? Okay. Any other public comment?
Question.
Ms. Delancey.
Hi, my name is Reagan Delancey, and I'm a senior at Cheyenne Central High School. And I would just like to talk to you guys today. I would love to attend vet school and come back to Wyoming, but it's really, really expensive. And I think if you guys initiated this and added the veterinary medicine to this bill, that could really help teenagers in Wyoming and students in Wyoming who want to bring veterinary medicine back to Wyoming to help out and keep Wyoming citizens and Wyoming students coming back to Wyoming. So I know vet school is really, really important, and I just wanted to chime in and say, thank you guys so much for even considering this, and I hope that you guys implement this.
Oh, thank you for your comments. We appreciate you calling in. It's
Thank
great.
you so much.
You bet. Any other public comment? Karen, do we know if there's anything more, any other panelists?
Mr. Chairman, at this time, I don't see anyone else.
Okay, then as proposed, and that we're just going to adopt as it's currently drafted, and we'll just assign it and work the two options of either eliminating it and the statutory language, or just modifying the funding and removing section 3. So with that, could we take a roll call?
Chairman, the motion's on 21 LSO 393 working draft 0.5 without any amendments. Representative Kinner.
Aye.
Representative Larson.
Aye.
Representative Schwartz.
Aye.
Representative Simpson.
Aye.
Representative Stiff.
Aye.
Representative Walters.
Okay, already voted.
Representative Walters.
Yeah.
Aye.
Senator Garreau. Senator Garreau.
Aye.
Senator Hicks.
Aye.
Senator Kinski.
Aye.
Senator Steinmetz.
Aye.
Co-Chairman Perkins.
Aye.
Chairman Nicholas.
Aye.
12 ayes, Mr. Chairman. House or Senate file?
We'll take one. House bill. Okay, it is now 12:14. Do you want to do one more, or do you want to break for lunch?
Lunch.
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 Don.
Mr. Chairman, going to lunch is fine. I promised that Mr. McKay would have at least an opportunity to address the committee. He was not able to get in on a prior piece of legislation.
No way. He missed his boat. Go ahead.
Mr. Chairman, I deeply apologize. I got lost in cyberspace trying to track you down. Just wanted to let you know something on the Education Commission of the States. I'm joined right now by Lachelle Brandon. She's Governor Gordon's Senior Policy Advisor for Education. And so she is also serving as the governor's proxy on the commission. And so she could answer any questions. I think you had a couple questions about the commission and the compact, but I wanted to just break in because we did have some recent updates related to the commission. And there are two things to consider for you. One is that we're working with the Department of Education because the superintendent is also one of the state's representatives on the commission and actually has served in leadership on that commission nationally recently. And so in reaching out to them, they were able to try to find some dollars that could be used within their existing budget, and have approached us to see if we can find any dollars to try to approach the commission and get a reduced fee to remain an active member. And so we would be trying to do that again. No request for additional dollars, but potential request to not pass the bill at this time, and to see if the commission would allow Wyoming to stay in under a reduced rate at this time, given our budget hardships. And so just wanted to make you aware of that. And the other part of that is we did also learn from the commission that they would be willing to and do have members of the compact who are inactive. So they cannot receive any of the benefits of being in the commission, but they remain in the compact. So you would not have to pass the bill, but we could be an inactive member of this as well. So just wanted to flag that for you, that what broke for us in the last few days was some more developments from both the Department of Education with some support to look for some funding on that front to try to stay in the commission and stay active, but also that there is the possibility we could stay in as an inactive member without you passing this. But again, obviously your prerogative if you wanted to move the bill forward. So just wanted to update you on that. And again, I apologize for missing earlier. I was trying to be responsive and available, and I failed.
And so, Randy, you know that the bill is passed out, and it's it's on the Senate side, I believe. House side. And so yeah, we'll be happy to consider that. And if we end up deciding not to pass the bill based upon your information, that'd be great. So. Okay.
Thank you, Mr. Chairman. Again, apologies.
Lachelle, do you have anything you chime in or?
Mr. Chairman, thank you. I appreciate you considering walking the bill back potentially. Wyoming's been involved in the compact since 1965. Former governors have served as the chair. As policy director mentioned, superintendent has been very active. And you, as legislative members, appoint 1 House and 1 Senate member to the commission, and the governor appoints 4. And that body does work with other states in partnership to really look at the best research and policies in the nation. And so I think it's a valuable resource for Wyoming to stay in the compact, and then for us to really dig deep to find resources, hopefully to be an active participant. So thank you for allowing us access to speak with you today, and I appreciate your consideration.
You bet. Thanks for doing the extra homework to find the money. That's a good deal. Okay. With that, it is now 12:19, almost 20. Can everyone make it back by 1? Since most of you are in your home. Okay, let's reconvene at 1 o'clock. All right. And Mr. Chairman Perkins, you want to take over at 1? All right.
Mr. Chairman?
Yeah, go ahead.
And so we'll be starting with the home healthcare bill, is that correct?
I believe so. Okay, we'll adjourn till.
Thank you.